lungs, okay, not just one bronchus or the right and left bronchus, branches of the bronchioles. Okay. And it happens usually in the infants alone. So it's a respiratory syncytial virus, okay? So that's the common one. They can have adenovirus too, but RSV is basically a respiratory syncytial. Affects more than 30 million children under age 5, okay? You pay attention to the age. Most common cause of bronchiolitis. If somebody comes with a bronchiolitis, the kid, you might think automatically is RSV, okay? Unless there is sometimes atypical cases. Asymptomatic can present as simple cold in more than 2 years of age. So more than 2, probably can be more than 5 too, but typically 2 to 5 is the age. Winter and early spring, involving small airways, same thing, inflammation and obstruction. So if you look at the pathophysiology in all those diseases, it's kind of the same. What is this doing? It's inhibiting your gas exchange. So these are some of the risk factors. We know that premature infants, why they're at risk, more than 5-year-old, the ones within 1 year is because of small airways, immature immune system. In the elderly, it's a decreased airway, COPD and CHF. Okay. Immunocompromised individual with cardiopulmonary disease, and the other infants who are not breastfed. What is the relation of breastfeeding? They get the antibodies from mom. It's like immunity. Okay, so they get immunity from the mom. So infants and children, secondhand tobacco, daycare. Okay, like I said, that's where all the boogers hang around in the daycares. So living in crowded conditions, socio-economically, it actually makes you more stronger. The more you get exposed to it, it's highly contagious. So what kind of precaution you will be on? Contact, respiratory, airborne, droplet. So you'll be on all those precautions. Okay? I usually say that those precautions like you are going in a place. You have to put everything on it. Okay? Your gown, gloves, and mask, and now we have to put those big shields too. Okay? So it can be seen that it's a direct from respiratory secretions, contact with contaminated surfaces. So you need a contact isolation, you need an airborne and droplet. So reinfection is common among the family members or contacts. So this is the pathophysiology, if you see that. So eventually here is called obstruction, not destruction. Okay. So if you see that at the end, so it causes obstruction. Okay, smaller airways and obstruction of the airway. Airways are still preserved, okay, because it's more like inflammation, but not like COPD. Okay. Starts as a simple common cold, you know, those little sniffles. You love those sniffly babies, but cough, then tachypnea. The other thing is RSV, since it's a kid's disease, you're going to pay attention to behavioral, okay? They're not going to tell you that I'm nauseous or something. They might be just cranky, they're not drinking enough, colicky. So pay attention to their behaviors. So irritability, excessive coughing and wheezing. How many times you probably, if your person tells you, you say, okay, that's just how RSV will go away. You know, usually as nurses we do that, you know. Okay, I need to go to work, let me just send to the daycare. Majority of the time it gets resolved, okay? So very few cases where you have to call. So these are the signs and symptoms you're going to tell the moms or the parents or the grandparents, caregivers. If they see these, they need to go to 911, call 911. Diaphragmatic, blue skin, they are not, you know, babies no matter what, they play. I mean, they're playful people unless they're really hurting. Nasal flaring, retraction, these are all signs of difficulty in breathing. So diagnostic test, usually it's a rapid diagnostic test they do it, just like a flu and COVID, now they're doing it. So they are antigen detection. Chest x-ray can do it because any lower respiratory airway disease can put the risk for pneumonia. Okay. It can start in the upper respiratory, then it goes down, then it can become pneumonia. So that's why it's important, chest x-ray and arterial blood gases, and also the CBCs. So prevention is keep clean, same thing we are doing now. Okay. Keep clean, no mask, probably. Stay within yourself. Secondhand smoke is another one. Avoid sharing food, cups, utensils if somebody is infected. On hard surfaces too. Okay. Collaboration with the respiratory required hospitalization. Okay, so majority of the time is if they are severe, so they require hospitalization. So monitoring breathing, airway, and this is a care team. So you can add too many people in there. There's a play therapist we added in here. See, you see that? Play therapist is added because don't forget. Okay, that does not mean that's only 4 people. Don't forget your lab. Don't forget your PCTs. Don't forget all the other care team. Bronchodilators, most infants do not benefit, so because it's just a virus, you know, it's not, there is no bronchial constriction, it's just a little inflammation going on. But in case it's severe, they can use it. They're not contraindicated, but they're not a best choice over here. Nebulized epinephrine not recommended, okay, and a rescue agent in severe bronchiolitis only. Okay. Corticosteroid questionable. Okay, it's just like it's a symptomatic treatment. You treat the fever, you make sure they're hydrated, okay, monitor their intake output, monitor their respiration, monitor for complications. Okay. So
my daughter, she was cold and she got it from one of my other kids and they just put her in this big like oxygen tent. So she was in there for a couple of weeks and there was nothing they could do but give her fluids and put her in the tent.
so that's what we used to do that. So you put the oxygen tent, or in the kids, you also put this like a little square box on their head, like they go, you know, that's a little oxygen tent just go on their head. So usually no effective therapy. Humidified oxygen is the best one. Sportative care is like a more symptomatic. You want to do the suction to keep that airways clean. So unless somebody has an infection or somebody is severe, they are on ventilator, at that time you can try bronchodilators and some antibiotics. Yeah, usually the kids, they just bounce up quickly after probably 7 days or something. So it's not only the adults can get RSV too. It's more common, but if you have a younger kids and your parents living with you, 2 generations, so the elderly can get too, especially in the long-term facilities. And the immunocompromised are the ones that are more risk, more severe and consistent with pneumonia, and typically resolves in 10 days. Okay. Viral, we know that it's like 10 to 14 days is usually their course for any viral disease. So in adults, you know that in the infants, we know that it's RSV, okay, respiratory syncytial virus. In the adults, the infection, it can be from organic dust, sand, smoke, human waste. Okay. The treatment is same. So same thing, the symptomatic treatment, hydration, rest, oxygenation. So nursing, we are maintaining airway, promoting effective respiratory function. Okay, tell me some of the nursing intervention you can do to promote effective respiratory function. You have a patient came with a bronchiolitis, coughing and deep breathing, encouraging liquid, making them in sitting in a Fowler position, semi-Fowler position. So those are some nursing intervention you can do there. So nursing assessment, so look at that here, we are adding something for the infant. We want to know their birth history. We want to know that when they were born. Okay, you want to know their gestational age too, because preterm or not preterm. And you also want to know any history or list of care providers. Okay, that's important too. So signs of increased respiratory, these are the usually, they get listless. Usually they just lie down there, they don't do anything. And these are mostly life-threatening if the respiratory rate is more than 70. They can go up to 60, okay? So infants go up to 60, the respiratory rate, but if it's more than 70, so that's not good. Same thing here, see, breathing, airway, so you always take care of airway, breathing, then gas exchange. So these are some of the things that you, as nurses, focus on your nursing intervention, okay? So what as a nurse you can do, or which one you're going to do first, which one you're going to do second. And here for airway clearance, so monitoring vital signs, auscultating the breath sound, assessing after putting the head up. Bulb suction is another one, don't forget that. You can do the bulb suction, you can do the nasal and oral both. Droplet, standard, and contact precaution. If the respiratory rate is more than 60 MPO, why we want to put NPO if the respiratory rate is more than 60? Why do you don't want to feed a baby who has a respiration high? They are at the risk for aspiration. Small and frequent feedings. Promote breathing patterns, teach caregivers, okay? Adequate nutrition, fluid balance, fatigue. See, remember that this is very important. Children, even they're ill, they play. You know, their fever goes down, they start playing again. So if they become quiet, so that means there is something going on. Home teaching, so adequate oxygenation. How are you going to tell them at home that person is having adequate oxygenation? What the parents need to watch in the kid? Color. What else?
Chest drive. The way they're breathing, chest drive.
They're breathing, like they're breathing effectively. It's not fast or it's not low. So those are some of the things you want to tell them too. And so these are the things that you want to tell them. So if that means it's getting worse, so they need to bring it back to the clinic or to the urgent care. What is the other thing that you can check on the infants to check for dehydration? What? What else?
The head.
That's different. Functional. Will be depressed or bulged? Depressed. Functionals are important, okay? And these are pretty self-explanatory. You want to do discussion on is highly contagious and frequent hand washing. Small infants who are at risk away from the person who is positive. Any questions on RSV? We can take a little break. We can jump into the next one.